Welcome to the Doctor of Nursing Practice Project Bootcamp mini-series. I am Denise Fitzpatrick, one of the faculty members for the DNP program. I currently teach in Nursing 851 and 854. I am here to walk you through the project courses. In this video, I am going to provide you with an overview of the 4 project courses, 851, 852, 853, and 854. As you can see, each of these courses progresses from the materials from the previous course. We start with Nursing 851, which is translating evidence into practice. In this course, you will explore the literature to evaluate the evidence on your desired area of interest. In this course, we focus on finding the background information for the clinical problem that you have identified to determine what literature is available. After you've determined what literature is available on your problem of interest, you will begin to explore project planning in 852. So in this class, you will develop a project proposal and you will follow the evidence-based practice model to progress your project. Then you will move on to 853, which is the project implementation phase, and lastly, 854, the DNP Project Evaluation and Dissemination course. In 851, as I had previously mentioned, we will focus on evaluating the literature. We start by exploring the background information on a problem that you and your organization have identified as a problem. We determine what evidence is available and determine whether or not this will be an appropriate DNP project. Sometimes we recognize when we look at the literature that there's not enough evidence out there. This program is not a research program. So unlike PhD students that try to do research on gaps in the literature, you are taking the evidence that's available and implementing that into a project at the facility with the institution that you have determined for your DNP project. At the end of this course, you will have developed your PICO question and completed an integrative review paper that will prepare you for 852. In 851, you will be asking a clinical question. So as nurses, there's always a family member or family friend who will ask you various clinical questions that you may or may not always know the answer to, depending on your specialty. Recently, a family friend asked me if pet therapy reduces stressors in school-age children. And I don't know the answer to that. I work in an emergency department. So in order to solve this clinical question, you turn to the literature. You search for pet therapy in school-age children and determine what literature is there out there on pet therapy and school anxiety in school-age children. So the first step is asking that clinical question. The second step is finding the best evidence. And then once you have the evidence, we evaluate the evidence. Are these strong studies? Were they designed well? Sometimes you'll notice that there's a lot of literature, but the studies might include biases or not be designed appropriately. The next step after you evaluate the evidence, if there's enough evidence to potentially implement this project, would be to look at evidence-based practice as a whole in terms of, will this project suit your patient population? So taking the literature that has been determined and determine, will this work in your clinical setting? Do your patients value this set change? Does the organization also feel that this is a problem? And is the solution feasible? In the past, we've had students that have tried to solve clinical problems such as timely documentation. Well, the literature shows that using scribes would reduce the amount of time it takes to document on patient care. However, scribes are very costly, so some organizations may not like that. Other literature shows that certain diabetic medications are the best option to maintaining good glucose control. However, if your patients cannot afford those medications, that option's not going to be the best option. So after you explore the evidence, you come back to the organization and you look at the clinical experiences at that organization and expertise along with the patient values and determine whether or not this is the best solution for your organization. From that, you then would develop your project from the literature and evaluate the outcomes. In the fall of your first year of the DNP project year, you will write up a DNP project proposal. You will submit this to the Institutional Review Board, the IRB. Once you have secured the IRB's decision, you can begin to collect data, which will lead you into 853. In Nursing 853, which is the summer of your second year, you will collect data and begin to analyze the data. This is the time when you will begin to write up your findings and have a good portion of your cumulative paper so that when you get to 854, you will be able to begin the dissemination process. In 854, you will work on disseminating the findings from all of your hard work over the last 3 courses. This is your final DNP project course. In this course, you will prepare a project poster and a presentation along with making sure that that cumulative paper is journal ready, and you will submit that manuscript to the Penn Commons. We review in this course the various mediums for disseminating your findings. We really look at, getting what you learned from your project out to others. If your project was very successful, getting it published so that others can look into similar evidence-based practice projects in their facilities. And if it was unsuccessful, determining possibly why. Maybe there needs to be more research determining if this is a best practice, or you've realized why it isn't the best practice for your institution for a variety of reasons. So we really look forward to you completing the dissemination course, and at the completion of your 854 course, in summary, the DNP project courses consist of 4 courses. Each builds on the previous course and follows the progression of the evidence-based practice implementation models. The final phase of implementation is disseminating the project findings. This Canvas site will include resources needed for each course, as well as resources commonly used throughout the project process, and will be available for the 18 months of the project courses. Good luck, and I look forward to working with each of you.